Okay, is it visible to all? Okay, so another category in the same unit, gastrointestinal agents. These are laxative, cathartics, and purgatives. All will be acting same, but the level of action will be simply different. This cathartic, purgative, and laxative are used in constipation mainly. Cathartics, let us define cathartics. Cathartics are the agent that promote the evacuation from the bowel, or you can say it is a defecation reaction. It is facilitating the passage and elimination of the feces from the intestinal tract. Okay, mainly used in constipation. Cathartics, it can be used for the constipation. It can be also used for the expulsion of the intestinal parasites. It is used for the clearing the colon before surgery or any diagnosis. It can also be used for the ease of defecation in case of piles and other relevant disease. Purgative is also a cathartic, but it behaves similarly. What is the difference? It is milder in action. So mild cathartic is purgative, so stronger one is cathartic, then mild to cathartic is purgative, and even mild than the purgative is laxative. So now normally if you are having constipation, therapy starts with the laxative, and if required in case of chronic constipation, then we are moving to the cathartics. These purgatives are stronger than the laxative but have milder action than the cathartic. So ultimately purgatives will be in between. Stronger one is cathartic, mild one, totally mild is laxative. And how we are having this defecation reaction? For that, peristaltic movement of your intestine muscle is there. So it will be working like this: contraction, relaxation, and this is how it will be passing the content out of the body. Okay, mechanism can be involved, different mechanisms can be involved, like lubricant. It will be lubricating your gastrointestinal tract. Example you can take is mineral oil and liquid paraffin. It will be lubricating your gastrointestinal tract. Bulk purgative. Okay, bulk purgative are the agent which will be forming bulk inside the intestine. Increase the bulk. Okay, so material what we are using is cellulose, isabgol, etc. Stimulants. So this is causing irritation locally on the intestinal mucosa, and these are from the herbal sources like senna, cascara, rhubarb. These are the example what you can have for this stimulants type. Saline. This is the salts, or these are the salts which is causing some osmotic difference. It will drag water inside your intestinal tract, and your feces will be watery and removed out of the body by the peristaltic movement. So magnesium and sodium salts of our interest, these are inorganic in nature, these are saline cathartics. So let us have this monograph, magnesium sulfate. Okay, it is also known as Epsom salt. And purity we required is not less than 99% and not more than 100% of magnesium sulfate. How you can prepare? You can have a reaction of magnesium carbonate with the H2SO4. From one, magnesium will be there, from another, sulfate will be there. And magnesium sulfate is our interest that will be collected or crystallized. Okay, similarly, it can be prepared from the mixture of magnesium calcium carbonate. Property: it is a crystalline, saline, bitter taste. It is insoluble in water. Okay, it will give you the characteristic reaction of magnesium and sulfate. Fine. If you will see the assay procedure for this, magnesium sulfate is titrated by complexometric titration. It will be reacting with this disodium EDTA solution. So magnesium will be making a complex with this. You are using ammonia, ammonium chloride For alkalizing the pH, we are titrating by using modern black 2 as an indicator. Okay, and finally from the factor, you will be calculating the amount of magnesium sulfate. It is used as a majorly saline purgative. Sodium orthophosphate. Okay, this is the sodium phosphate. So simply, if you can say trisodium orthophosphate, trisodium phosphate, etc. These are the synonym. It can be prepared by the reaction of sodium carbonate and phosphoric acid. So one will be having your phosphate part and another will be having your sodium part. And compound of our interest is sodium phosphate. So one more time from this CO2 and H2O are there. Along with this, CO2 will be liberated, and by the reaction of sodium hydroxide you are having this sodium phosphate. Okay, what we want is this. It is again crystalline powder soluble in water. Phosphate salts are always soluble in water, so it can be used as an laxative. Okay, last category, that is for the protective and adsorbent. Now we want protection on the mucosa from the stomach acid while we are having peptic ulcer. So if you are having a protective layer, the healing of the ulcer will be fast. One example I will give you is bismuth salt, bismuth subgallate, bismuth subcarbonate. These are these salts which will be mainly used as a protective. And in case of adsorbents, we are having this bentonite, then we are having this kaolin. These are the clay which are having absorbing capacity also. So diarrhea and dysentery, these are the two problems. Diarrhea and dysentery may be due to the toxin in the food or microbial presence, microbial toxin. So this poisonous substance can cause the diarrhea and dysentery. Okay. So these toxins will be absorbed, physically absorbed by this bentonite, and this is why it is adsorbent. So you can have dysentery by the microbes, bacteria and amoeba. For the protecting, you are having bismuth compound, bismuth subgallate, bismuth subcarbonate, heavy kaolin, which is a clay. Simply, it is a clay. Kaolin is a clay, which is consisting of the various amount of calcium, magnesium, and ferric oxide impurities. So this chemical formula you can consider. This is simply aluminum silicates. You can say it is a pharmaceutical aid. Okay, and it can be prepared by treating the natural clay with the hydrochloric acid, where other part will be removed. If you will consider the property, it is a fine, soft powder, odorless, tasteless. Now, it can be available in two versions, heavy and light. Both are the same, simply some mild differences there, and you can prepare light by some particle size separation. So this, from the gritty particles, you are separating particle by mean of this electrical sedimentations. Okay. Bentonite is again aluminum silicate, but it is a hydrated aluminum silicate. It is also having some other salts. If you will see the property, it is fine, non-gritty, slightly earthy in the taste. It is a powder which will be having some swelling capacity. This bentonite is having swelling capacity additionally. The volume of the bentonite powder in the water will be enhanced. It can form some what we can say viscous, some gelatinous texture. It will be forming viscous texture. That is why we are performing this gel formation test. Swelling factor, where you will be immersing some quantity in the water, it will be swelling. So what is the clear portion in the measuring cylinder and what volume has expanded, what we are calculating. These are the tests we are performing: gel formation and swelling factor. We are also checking the fineness. We can pass through the sieve and we can check how much gritty or non gritty it is. So this is how you can check the fineness. Another test we can perform is loss on drying. Loss on drying is something that we perform for the powder, where the powder is having some volatile content, or you can say moisture content or water. So when you are drying the powder, moisture will be evaporated, and whatever amount that is remaining, okay, that will be some loss, and this loss will be calculated from the mathematical calculation: initial weight, final weight, and the difference. The bentonite can be used as an adsorbent protective, and it is used as a majorly pharmaceutical aid. You can use it as a suspending agent, you can use it as an emulsifying agent, many of the plasters, and it is stored in a tightly closed container. So this is the basic thing. These are the total content that is involved in your syllabus, and additionally you can read some extra monograph. Okay, these are the prime requirement that we are finishing this first, and for your what we can say, for your knowledge or for your any additional reading, you can go for the extra monograph that is given in the book. And these are the minimum requirement of the syllabus, and this is where we are concluding the gastrointestinal agents. This was the major revision today. Okay, so now if anybody is having any query, you can ask me.